Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population.
Hello, my name is Jennifer Price, and I am the managing editor of the Southern Medical Journal, the peer-reviewed journal of the Southern Medical Association. Today, we are joined by Editor-in-Chief Dr. Steve Baldwin, who will spend some time telling us a little bit about himself and what his vision is for the Southern Medical Journal. Thank you for joining us today, Dr. Baldwin.
Thank you, Jennifer. Hello, I'm Steve Baldwin. I'm the Editor-in-Chief of Southern Medical Journal. The purpose of this podcast is to review the mission of the Southern Medical Journal and the ways that the Southern Medical Journal supports stakeholders. First, let me introduce myself further. I graduated from Albany Medical College in 1982. I completed a residency in pediatrics, a fellowship in pediatric critical care medicine, and a fellowship in pediatric emergency medicine at the Children's Hospital of Alabama, University of Alabama at Birmingham program. I served as a general medical officer attached to the Marines and as a general pediatrician to repay my Navy scholarship obligation. I also worked as a pediatric intensivist/hospitalist at a hospital-based practice for a couple years at Baptist Medical Center in Columbia, South Carolina, before I became a faculty member in the Department of Pediatrics at the University of Alabama at Birmingham approximately 25 years ago. I've been practicing as a pediatric emergency medicine specialist this entire time. Along the way, I've also earned a Master of Business Administration degree and a Master of Science in Healthcare Quality Science degree. Mary Sue, my wife, and my 4 children are a tremendous blessing to me. My 2 sons are pursuing careers in software engineering, and my 2 daughters are in the process of becoming physicians. I love the many facets of practicing medicine, including meeting patients and their caregivers and helping them deal with clinical issues. I also enjoy teaching and helping others to learn and succeed. I run to keep in physical shape and exercise my mind through lifelong learning efforts. The mission of the Southern Medical Journal is the next topic I'd like to address. Now that I've been on the job as editor-in-chief for a few months, I have a better understanding of the roles of medical journals in general and the Southern Medical Journal in particular.
Could you share with us what your vision for the journal and the mission you have for the SMJ?
The mission of the Southern Medical Journal is to serve its stakeholders by using print and other formats to publish scientifically based medical science information with the intent to improve the practice of medicine. Stakeholders in this effort include patients, their families, supporters and caregivers, providers of care, educators and students, scientists, administrators, and other decision makers, and society. More specifically, the main ways the Southern Medical Journal fulfills this mission is by publishing peer-reviewed research studies relevant to the science of medicine and medical practice, publishing peer-reviewed discussions of information regarding medical science and medical practice, publishing peer-reviewed reviews of a clinical topic, publishing peer-reviewed commentaries and/or perspectives related to a clinical topic, publishing occasional items which celebrate major accomplishments or uplifting items in medical science or practice, and publishing occasional items which identify significant changes in Southern Medical Journal policy or processes. To support publication of these items of information, Southern Medical Journal will continue to strive to provide constructive inputs when possible and relevant to authors regarding their study design, data analysis, other scientific methods issues, and effectiveness of communication issues, which are noted during peer review The intent is to improve the scientific basis and the effectiveness of communication by the authors. We will also strive to identify, eschew, and refuse to publish manuscript submissions with indicators of perceived conflicts of interest, scientific misconduct, ethical concerns, plagiarism, inappropriate involvement of commercial entities, or other issues which raise concerns that the submitted manuscript is biased, incorrect, or otherwise inappropriate for publication. We also strive to avoid perceived conflicts of interest or interference involving persons or entities external to the editorial, reviewer, and operational functions of the Southern Medical Journal. And also, we intend to identify, notify, correct, and/or redact errors when they are identified.
Tell us a little bit about the Southern Medical Journal team.
The success of the Southern Medical Journal begins with the team of individuals who perform the operational and administrative tasks necessary to deliver the product and services provided by the journal. I would first like to make special note of the tremendous effort, wisdom, and leadership of Dr. Richard Holt, who served as the editor-in-chief of Southern Medical Journal for many years until 2020. The current vision and mission of the journal are largely the result of Dr. Holt's efforts to specify and refine the mission of the journal in response to many changes affecting medical journals during his tenure as editor-in-chief. These include the extraordinary growth in the breadth and the rate of medical information being generated during the last many years, which at present continues to grow even more rapidly. In response, our editors and reviewers have been and continue to be challenged to learn continuously more and more about developments such as process and quality improvement in healthcare, evidence-based medicine, data quality and analysis, computerization, burnout, other issues, and whatever other new domains that are yet to arise. The process of reviewing and publishing medical information, along with operating the journal, has evolved as well. Thanks to Dr. Holt, the Southern Medical Journal has an outstanding operational foundation to build upon, period. Dr. Holt also grew and supported the team of reviewers who are critical to delivering the peer review process for manuscripts submitted to the Southern Medical Journal. Without these committed and very talented people, the journal would not exist. Collectively, these reviewers provide expertise across a very large array of specialties and include physicians, nurses, pharmacologists, public health experts, education experts, nutrition experts, social scientists, administration experts, and several other types of experts. Jennifer Price is the managing editor for the Southern Medical Journal. She is a critical member of the team who keeps the editorial and administrative functions of the journal running smoothly and responsive to the changes in medical journal practices, period. She has many years of experience with the operational, technical, and other aspects of medical journalism. Through her wisdom, experience, and hard work, the Southern Medical Journal has benefited greatly. Authors who trust the Southern Medical Journal to review and provide useful inputs regarding their manuscripts are important stakeholders as well. The journal is blessed with a large number of authors from numerous different organizations who choose to submit their work to the journal. In return, the journal team works very hard to provide inputs to the authors that will help them successfully communicate their discoveries and insights via the journal in a scientifically valid and accurate manner. The Southern Medical Journal also greatly appreciates the commitment of the membership, the board of directors, and the administrative team of the Southern Medical Association as well.
Is there any additional editorial and administrative information you would like listeners to know more about?
The Southern Medical Journal maintains a website. This website contains a page titled Instructions for Authors that contains detailed information regarding how to submit a manuscript to the Southern Medical Journal. Contents of the current and previous issues of the journal, contact information, and other items of potential interest are also contained on the website. The Southern Medical Journal welcomes individuals who desire to serve as reviewers. Persons who are interested in becoming a reviewer for Southern Medical Journal should contact Jennifer Price, the managing editor. The journal generally publishes a CME article each month. One CME credit can be earned each month by reading the article and learning material and passing the quiz. Southern Medical Journal is committed to continuing this practice. The challenges of the COVID pandemic have created pressure to alter peer review processes in order to publish COVID-related and even non-COVID related information more rapidly. The journal recognizes this sense of urgency. However, the Southern Medical Journal believes substantial risk of harm exists when preliminary publication prior to peer review, truncated peer review, or pressured peer review occurs. Therefore, the Southern Medical Journal will continue to require completion of peer review before any manuscripts are published.
Are there any concluding comments you would care to make?
I look forward to serving all of the stakeholders of the Southern Medical Journal as editor-in-chief. I thank all of the authors, readers, staff, reviewers, and other people who contribute to the production and application of the information contained in the journal each month. I also welcome people to please feel free to contact me anytime if you have inputs or concerns. I want to conclude by thanking everyone for their efforts to help their communities deal with the tremendous challenges of the COVID-19 pandemic. The good news is PPE really does work when used consistently and meticulously. Public health interventions work too. The challenge is to avoid weak moments. Please frequently remind yourself that you are doing a good job so that you can increase your energy and maintain your diligence and persistence. Focused and even random small acts of encouragement will help others gain energy and persevere as well. Thank you also for continuing to care for the even larger numbers of patients with clinical needs unrelated to COVID-19. Best wishes and stay safe.
Thank you so much, Dr. Baldwin, for taking some time to chat with us today. We really do appreciate it.
Thank you very much, Jennifer. I also enjoyed it.
For those of you who would like to contact Dr. Baldwin, he may be reached at sbaldwin@sma.org.
Thank you again for joining us. To subscribe to additional SMA podcasts, please visit sma.org/podcasts.